Remember, the rotator cuff is primarily responsible for securing the ball of the humeral head into the socket of the scapular glenoid fossa, and therefore there's no need to restore the bony thorax at this point, but we'll briefly display the thorax to clarify and recall the relationship and orientation of the scapula to the chest. The subscapularis muscle belly is affixed to the undersurface of the scapular blade, and the tendon passes under the coracoid process, then attaches to the lesser tuberosity of the humeral head. Its primary functions are internal rotation of the upper arm and stabilization of the shoulder joint. The remaining three structures of the rotator cuff originate from the back of the scapula. Beginning at the top, the relatively small muscle above the scapular spine is, appropriately, the supraspinatus. The tendon passes directly beneath the acromion and attaches to the greater tuberosity of the humeral head. Its primary functions are abduction or raising the arm, especially through the first 15 degrees of the arc, and stabilization of the shoulder joint. The infraspinatus is a large muscle originating from the infraspinatus fossa below the scapular spine and similarly attaching to the greater tuberosity. Its primary functions are lateral rotation of the upper arm and stabilization of the shoulder joint. The most inferior member of the cuff is the teres minor. Originating off the lateral border of the scapula, the tendon again attaches to the greater tuberosity. Its primary functions are similar to the infraspinatus, with lateral rotation and stabilization of the upper arm. These are the four muscles of the rotator cuff.